Hi, Shaw.
Hi, how are you?
I'm fine.
Great.
Let's just do some casual chatting, okay?
Sounds good.
Tell us about yourself.
My background is in fine arts, and I have a master's degree in that. And
I didn't know that.
Yes, yeah. Before I went into psychology, I was very interested in art, so I'm very much in tune with the symbolic language, which is, of course, what Jung and most of the pre-verbal, prehistoric cultures have been telling us.
I didn't know that.
It's been symbolic.
So do you paint? I'm just nosy.
I do paint and draw and sculpt.
Oh,
yes.
All right. Okay. And how did you move on to psychology?
What I found is that for me, I was really fascinated in why do people make the image, what are images about, and what's the connection between the literate culture that has really reduced everything down to sign language and very analytical thinking, and how is it that the more symbolic cultures, both prehistoric and pre-verbal, had come out with great concepts that, say, the archaeologist Marie Gamboudas talks about, that they were a very relational society that knew the distance to the sun and knew things about the universe that we have forgotten as we become more preoccupied with our thoughts and not with our center of awareness, our intuitive that Jung would talk about.
And how did you make the leap of faith, if I may say that, to Tong Ren? You are a well-trained academic person with high intellectual capabilities,
right,
and degrees behind
right.
you. Why do you do this crazy stuff?
Well, the crazy stuff, as it turns out, for me was going into psychology as a doctor of psychology and just being restricted to work with one modality. Like in cognitive, working with depression or addiction, they really wanted you to stay cognitive, where I found that a lot of times interpretation of dreams, which would be symbolic, would be very beneficial, but would be disallowed. There were certain things that the government would try to control, and I didn't feel comfortable with that.
Am I wrong in thinking that this is all legally restricting? That you shouldn't do certain things?
There are in psychology, there are certain areas which you don't go into.
Really?
And depending on what the modality that the center or the institute wants you to work in, they would specify that. Oh, sure.
Would you be sued or kicked out of the club if you cross the line?
Pretty much reprimanded, and they
not good.
Would want you to stay with that. And then, of course, the other thing that wasn't there is if it wasn't linear, if it wasn't something that they could explain, they'd have a very difficult time with it, such as Jungian thought or Taoist or
tell me about
the spiritual part of it, which I always enjoyed, because I said, well, of course this is how we know who we are, and we developed an awareness of the world before we actually.
Yeah, but how do you measure it? I'm sorry.
Yeah, how do you measure that? Right, exactly. How do you measure the soul? I mean, we're much bigger than our imaginations and our thoughts.
I agree with you absolutely.
Yeah.
So, if someone comes to you for emotional help, like they are like depressed or something, can Tong Ren help?
Oh yes. I use Tong Ren and I integrate it with the other modalities that I've thought of. So one of the things that Tom teaches, and it's very consistent with the Silva method, is to bring the body down and the energy of the body, to slow the heart rate, to slow the limbic system, to slow everything down so that you're not fighting with the mind and the body. Once the body relaxes, once the breathing changes, then I begin to work counting down and relaxing the mind. And then the chi, that bioelectricity, that non-visible force, can really flow freely because there's no restrictions, and balance takes place more naturally.
That's what you did starting out your class with, right? Today,
Yes.
earlier today,
Yes.
I was there.
First, bringing people, we're so much in our mind, thinking, rheumatizing, wondering what it is that we do, and that we keep all the energy in the head, but by bringing it gradually down into the center, into the soles and the feet, and into the center of our being, we become much more attached to our personal, our collective unconscious, and also to our deeper part, our soul.
That worked on me. That really did something
Yeah.
to me. Can you tell us something more about the collective unconscious that Tom uses all the time? I
Right.
mean, what is it all about?
It's a good subject. It's a difficult one to talk about, but the way it's basically transpersonal energy. It's universal energy. Different cultures put different names on it. The Tao is that. It's that which cannot be named. It's the peace that goes beyond understanding.
That's good.
So in every tradition, it's really thought of as something that's outside of the individualistic experience. So it's something that's coming into the soul, and we resonate with it because it is part of us and we are part of it. Interconnected.
That's a very good explanation that may work with even laymen, I think. I think you put it in a very simple way. Well, I mean, it all makes sense to me.
We have an innate knowing, and it's a difference between knowing and belief. Belief is something we've studied, something we've read, something we've been taught, but knowing has that kind of feeling of instinct.
You just know it.
It's an epiphany. It just comes to you, and you know it's right. And so you depend. What my goal is in therapy is to help people to trust themselves, and self in the capital as Jung would be, the creative diamond, their soul's code.
So, would you call yourself a Jungian? Or?
I would say that I draw a lot from Jungian, and have learned a lot about how to take Jungian to the next step, and I think that's what Tom does. He takes that collective energy and he's able to put it into physical and mental, spiritual terms and open up blockages. Those can be blockages of the mind, blockages of the soul, blockages of the physiology. It's a holistic science. It's not just restricted to thinking, or what's unfortunate with the profession, psychology today, is most, or a lot of the highly trained people are just drug administrators, and they spend very little time actually doing the therapy. So I think Freud, Adler, Jung, all these people would be very upset to think that we had given so much power to the drugs.
Giving prescriptions is the job of psychiatrists, not psychologists, right?
Well, psychiatrists, yes, those with a medical degree, but they are not doing the therapy. I mean, Jung was a psychiatrist, psychologist as well, so he had the medical background. So
I didn't know that.
Well, Freud actually abused and found out later. He started with the cocaine. Yeah, he was experimental with that, used that, thought it was a miracle cure, and then he found out the effects. But yeah, that was one of the
cure
things.
For what?
Well, he would use it for his treatments with patients. Cocaine. Yeah.
Like what kind of patients? Like schizophrenia?
He would do that, and I'm not remembering exactly what their diagnosis was, but it was depression and all kinds of things. He felt it really affected the spirit and was a positive way to go. I think he recoiled from that, though, and really invested back into the analytical, so the talk therapy.